Smith. My name is Allie. I'll be your student nurse today. Can I just check your band here? And can you confirm your name and date of birth for me? Okay, great. Everything matches. I'm going to go ahead and wash my hands. And I'm going to put on some gloves. How are you doing today, Mr. Smith? Good? Are you in any pain at the moment? No? Okay, good. Well, I am here to do an assessment of your heart and lungs. Let me just quick pull up the doctor's orders and make sure that everything matches. Yes, okay, so your doctor wants me to assess your heart and lungs today. Are you having any difficulty breathing, any chest pain, any coughing? No? Okay, all right, sounds good. So no pain at all in your chest area? No? Okay. All right, well, we're going to do a little bit of palpation today, so if you start experiencing some pain, just let me know. Let me gather up all of my supplies, and we'll get everything ready. And then I'm going to pull the curtain and provide us some privacy. Okay, so the first thing that we're going to do is I'm going to look at your chest, and I am going to observe your breathing and then listen to your heart sounds, okay? So can you just go ahead and take a deep breath for me? Okay, great. I did not notice any heaves or lifts with breathing. All right, so next thing I'm going to do is I'm going to use my stethoscope to listen to your anterior chest to hear your breath and heart sounds. Okay, so we're going to start at the aortic, first point, tricuspid, and then the mitral. Okay, I'm going to do the same thing on the other side here. All right. Everything sounds good. The rate and rhythm were all normal, and there were no extra sounds or murmurs, which is a normal finding. Next, I'm just going to inspect your neck veins. At rest, I don't see any distension, which is good. That is a normal finding. I'm just going to palpate your carotid arteries, okay? All right. Okay. The carotid arteries have a pulse that is equal bilaterally, and the rhythm was regular. Now I'm just going to use my stethoscope to listen to your carotid arteries to see if there's any fluids.
I checked the doctor's orders to make sure that we are doing a chest long throat and heart.
All right, there was no presence of fluids, which is again a normal finding. So now I'm just going to move on and assess your upper extremities. So I'm going to pull your sleeve up a little bit here so I can see your shoulder. Okay, there's no abnormalities noted. The skin color is normal. There's no masses or lesions present. I'll look at your other upper extremity here. Okay. Everything appears normal on the other extremity as well. Okay. So I'm going to check your capillary refill. Okay, that was under 2 seconds. I'm going to check on this finger. Once again, under 2 seconds, which is a normal finding. Now I'm just going to check your radial pulse.
My name is Megan. I'll be your nurse today. Could you confirm your first name and date of birth?
Radial pulse.
I see I'm going to be performing some heart and lung sounds on
Okay, I'm going gonna check on this side.
Is that correct? Is there anything else?
You're doing good.
I'm like,
All right, the brachial and radial pulses were present bilaterally. They were strong and equal and 80 beats per minute. All right, so now if it's okay with you, I'm gonna inspect your lower extremities. Just gonna pull back the blanket a little bit, but I will keep you covered as much as possible.
my name's Pagan, I'm gonna be your nurse today. Could you confirm your
Okay.
last name and date of birth for me?
Color and skin tone is normal.
I'm gonna be performing a heart.
Temperature is normal. I'm gonna check your popliteal pulse,
Is there any other reason you're here today?
Nope, no reason.
your posterior tibial pulse,
Nope, no pain or discomfort.
Okay.
and your dorsalis pedis pulse.
I'm allergic to
And
peanuts.
then I'm gonna do the same thing on the other side.
In this situation, so, in this assessment. Yeah, but I can't run this. Have you had any surgeries on your chest or on your, arms, legs?
Nope, no surgery.
No, perfect.
Okay, all of that looks good. The pulse was strong and equal bilaterally, which is a normal finding. And then I do not see any presence of edema, which again is a normal finding. Just gonna check your capillary refill. Okay, capillary refill was under 2 seconds, which is excellent. I'm gonna cover your legs back up to keep you warm. All right, Mr. Smith, are you doing okay still? Okay, any pain at all, or are you still doing okay? Okay, excellent. You let me know if that changes. Okay, so what we're gonna do now is we're gonna move on to assessing your chest and your lung sounds. Is that okay with you, Mr. Smith? Do you need anything before we continue? Okay, excellent, thank you. All right, so at rest, Mr. Smith is showing no signs of respiratory distress. His breaths are moving equally and bilaterally, and there is no use of accessory muscles noted. His skin color and condition is normal in the chest area. All right, so now, Mr. Smith, what I'm gonna do is I'm gonna percuss your lung field to see if I notice any differences in sensation. Okay, is that all right with you? Okay, we're gonna start over here on this side. It's gonna be the same. Everything was normal on this side. I'm just going to do the same thing on the other side. Okay. There was no abnormalities noted with percussion, which is a normal finding. So now we're going to move on, and I'm going to use my stethoscope to listen to your lung sounds. Is that okay, Mr. Smith? Okay, so what I need you to do is every time I place my stethoscope, I need you to take a deep breath for me, okay? All right, I apologize if my stethoscope's a little cold. I did just clean it for you. Okay, so go ahead and take a deep breath for me. Okay.
Moving on, I'm going to pull down your gown again, is that okay? So, you can go back to and I'm going to just do more heart sound, to your lung sound this time.
Do you have any
And when I do that,
issues with your
I want you to breathe in through your mouth and out through your mouth. I want you to take some deep breaths when I tell you, okay?
Okay.
Put it on half,
Okay, no.
All right, Mr. Smith, your breath sounds were equal and clear bilaterally. There was no crackles or wheezes noted and all lung fields were clear. Okay, so what we're gonna do now is I am going to have you sit up if that's okay with you, Mr. Smith, so I can assess your posterior chest. Okay. Do you have any issues with sitting up for me? Okay, excellent. Then I'm gonna help you into a seated position. Alright, is that okay there, Mr. Smith? Okay, I'll try to be quick and then I'll get you comfortable in bed, okay? Alright. So the skin on the back, the color is normal. There's no abnormalities present, no masses, no lesions. Alright, the anterior and posterior diameter appears to be normal. Alright, Mr. Smith, so what I'm going to do next is I'm going to put my hands around your T10 area, and I'm just going to ask you to take a nice deep breath for me. Okay, my hands were moving bilaterally and equally, which is a normal finding. Okay, next I'm going to move my hands in a couple of different spots, and every time I move my hands, I want you to say the word 99. Is that okay, Mr. Smith? Okay, excellent. 99, 99, 99, 99, 99. Okay, everything was normal there. There was no phreatitis present, which is a normal finding. Okay, and then the last thing I'm going to do here is I'm just going to palpate and see if I feel any crepitus, okay?
You deliver one section and then the other 2 sections she records and then gives us so we have to take notes on.
3 things an hour long.
Like, I feel like
Alright.
we should just begin
Percussion was normal. I did not hear
Okay, there was no crepitus present, which is a normal finding. The skin color and temperature is all normal in the chest area. There's no lesions or masses present. So the next thing I'm going to do is I'm going to do some more percussion on your lung field and check and see if I feel anything abnormal, okay?
Yep, that's fine.
no distension, oh, you're right.
Okay, and I'm going to do the same thing now on the other side.
your back. I do not see no lesions. The color is normal for your ethnicity. It is warm and dry to touch. There's no bruises.
Okay, Mr. Smith, there was no abnormalities noted with percussion. So what I'm going to do next is I'm going to use my stethoscope to listen to your breath sounds. So we're going to do the same thing that I did on your anterior side here. So every time I place my stethoscope, I want you to take a nice deep breath for me, okay? All right, do you need a moment before we get started? Okay, all right, excellent. Thank you, Mr. Smith. All right, so go ahead and take a deep breath for me.
Deep breath in.
Okay.
Deep breath in.
All right.
Deep breath in. Deep breath in. Deep breath in. Deep breath in. Couple more. Deep breath in. And deep breath in. All right. The heart sounds.
All right, Mr. Smith, once again, your lung sounds were clear in all fields. And there was no crackles or wheezes present, which again is a normal finding. That's what I was hoping to hear. Okay, Mr. Smith, I'm going to help you back into a laying down position. All right. So that is the end of my assessment for you, Mr. Smith. Do you have any questions or concerns for me? No? Okay, well, I appreciate your cooperation. You feeling okay still? No pain? All right, wonderful. Well, I'm going to leave you here and let you get some rest. I have your call light in reach, so just let me know if you need anything.
All right. I did not hear any